Welcome everyone to My Weight World TV. I'm Dr. Brenda, MD, and joining me today is Dr. Lauren Zachary, a board-certified plastic surgeon and director of plastic surgery at Weiss Memorial Hospital in Chicago, and associate professor of plastic and reconstructive surgery at the University of Chicago. Welcome, Dr. Zachary.
Hi.
Let's start out with, tell me a little bit more about yourself and how you became involved with plastic surgery.
Well, as a general surgery resident at the university, I did a lot of procedures that were negative. I'm a very positive person. I like making people feel better, and plastic surgery is a very positive field. We do things that we make people feel better about themselves, we add things, we reconstruct things. So being a positive person, I felt that was the best field for me.
That's great. What is your philosophy when dealing with overweight patients?
Well, overweight patients have a different whole set of problems. They've had bariatric surgery before, and now they have excess skin everywhere. Their abdomen, their back, their hips, their arms, their legs. And so they look in the mirror and they don't like what they see. So I'm there to put them back together, to make them feel normal again, like whole people.
What are some of the typical procedures that you perform?
Well, I do everything from head to toe. But first we usually start off with a thing called a belt lipectomy, where we take off the skin from the abdomen, the hips, and the buttocks, and we make the abdomen tighter. Then as another stage, we probably take off the skin from the arms and the legs, and maybe lift their breasts up, which hang down maybe to the waist sometimes, because they're deflated after the weight loss.
How about liposuction?
Liposuction is the key to everything.
Okay.
Although we don't use it a lot of times as a primary procedure, it deals with everything we do. Even when I do a case where I do a lipectomy, there may be localized areas of fat which you take off to reduce those so the contour is better once the procedure is completed.
How is liposuction performed?
Well, we do a thing called ultrasound liposuction, which takes care of the fat cells by dissolving them with waves of energy. And first we inflate the tissues with fluid, then we use the ultrasound device to burst the fat cells, then we remove the rest of the tissue and fluid with some traditional liposuction and restore the contour that was there before they had the fat gain.
Is the result permanent?
Well, fat cells are usually made only at birth and during puberty. Fat cells get bigger and bigger when we eat hot dogs and hamburgers. So once the fat cells are gone, they're gone forever.
Are these procedures cosmetic?
Sometimes yes and sometimes no.
So then does insurance pay for it?
Insurance sometimes covers the abdomen, but they may have a hernia associated with the excess skin they have, and the excess skin may hang down to their thighs, causing rashes and infections under the skin, so they cover this as medical necessity.
So follow up with your doctor to see if your procedure will be covered or not.
Correct.
Okay. And in your experience, tell me about some of the lives that you've changed with these procedures.
I'll give you an example which is a very profound change in someone's life. He adopted kids because he couldn't have kids, and after his weight loss, he had excess skin hanging down almost to his knees. His kids were 4 and 5. He wanted to take them to the park, to the pool. He'd do none of that stuff. So he came to me. By resecting the excess skin, he's able to participate in his life again with his children and his family by taking them to the park, going to the pool, and being part of their lives again.
Wow, complete change in his quality of life. Huh?
Yes.
Well, thank you for joining us, Dr. Zachary.
Thank you.
And thank you. Please tune in again to My Weight World TV so we can help you reach your goal with our community. I'm Dr. Brenda, MD, and thanks for watching.